about septic arthritis. It is also known as pyogenic arthritis, infective arthritis, suppurative arthritis. This is an arthritis which is caused by pyogenic organism. Typically, it presents as acute painful arthritis, but it can be subacute or chronic arthritis. On etiopathogenesis, the most common organism causing septic arthritis is Staphylococcus aureus. Pneumococcus and gonococcus can also cause septic arthritis. The organism reach the joint by the following routes. On hematogenous route is the most common route, in which the primary focus of infection is in pyoderma, throat infection and septicemia. From nearby osteomyelitis, the organism can reach the joint, which is common in joints with intra-articular metaphysis, for example hip joint and the shoulder joint. It can also reach through the penetrating wounds, which is most common in the knee joint, as knee joint is the superficial joint. Iatrogenic cause can also cause the organism to reach the joint, following intra-articular steroid injection in different arthritis, and femoral artery puncture for blood collection. During blood collection from the femoral artery, the organism can reach the joint. In infants, if there is umbilical cord sepsis, through this organism can reach the joint. As organism reaches the joint, there begins an inflammatory response in the synovium, resulting in exudation of the fluid. The joint exudates contain inflammatory granulation tissue and lysosomal enzymes, which cause the destruction of the joint cartilage, and the outcome can be from complete healing to total destruction of the joint. It is most common in children, and males are more susceptible. And other predisposing factors are poor hygiene, poor resistance and diabetes. On clinical feature, knee is the most common affected joint, and the hip joint, shoulder joint, elbow joint can also get affected. On symptoms, in acute form, child presents with severe throbbing pain, swelling and tenderness of the joint. It is also associated with high-grade fever and malaise, and the child is unable to use the affected limb. On examination, the child is toxic with high temperature and tachycardia. Affected joint is swollen and head in position of ease, which is the position in which the joint has maximum capacity to accommodate pause. On palpation, there is increased temperature, tenderness and effusion, severe limitation of joint movements in all directions. On differential diagnosis can be acute osteomyelitis, rheumatic arthritis, hemophilia, tubercular arthritis, acute bursitis, transient synovitis and psoas abscess. On investigation, we do the X-ray. X-ray is usually normal, but soft tissue swelling and increased joint space can also be seen. On MRI, effusion, synovitis or cartilage destruction may be seen. On aspiration of the joint, confirms the diagnosis by culture and sensitivity, and it also has to differentiate from transient synovitis and decreases intra-articular pressure and reduces chance of avascular necrosis of the femoral head. On treatment, we can do arthrotomy, which is opening of the joint capsule, surgical drainage, decompression can be done, synovectomy, and the antibiotics can be given. From 6 months to 6 years, IV flucloxacillin plus third generation cephalosporin is given. For adults, flucloxacillin with fusidic acid is given, and the duration is 2 weeks IV and 4 weeks oral. Non-operative treatment is not considered in joint infection, as cartilage damage occurs very rapidly and can cause permanent joint destruction. The complications can be subluxation, dislocation and instability, which is the posterior dislocation of the hip, damage to the physis and epiphysis, which can lead to growth retardation, joint deformity and stiffness, acetabular dysplasia and pseudoarthrosis, articular cartilage erosion, chondrolysis, secondary osteoarthritis and ankylosis, which is the pathological fusion of the bones in a joint, which leads to stiffness of that joint. Septic arthritis results in bony ankylosis, and it is the most common cause of bony ankylosis. Tom Smith arthritis. This is the septic arthritis of hip in infants. It destroys the cartilaginous femoral head rapidly and completely, which is called chondrolysis. Child presents with limb, unstable gait, shortening of the limb, telescopy, and increased hip movements in all directions. And on treatment, it includes procedure to stabilize the hip. This is all about septic arthritis. Thank you.